Slipped disc. A slipped disc is also called a prolapsed or herniated disc can cause 1. Lower back pain. 2. Numbness or tingling in your shoulders, back, arms, hands, legs or feet. 3. Neck pain. 4. Problems bending or straightening your back. The 5 lumbar vertebrae form the lowest part of the spine above the sacrum. Sacrum is bone at the base of the spine. They each consist of a body and a semicircular rear arch. The channel passing through the arches forms the vertebral canal, which contains the spinal cord and nerve roots. The vertebrae are separated by intervertebral discs. They consist of an outer layer of fibrocartilage and a soft core of gelatinous material, the nucleus, that thins and hardens with age. Lumbar disc disorders can cause severe lower back pain. Sometimes they cause few or no symptoms and are found only incidentally on X-ray. What is prolapsed disc? A herniated disc is an injury of the spine, backbone. You have a series of bones, vertebrae, in your spine, stretching from the base of your skull to your tailbone. Between your vertebrae are round cushions called discs. The discs act as buffers between your bones, allowing you to bend and move with ease. When one of these discs tears or leaks, it's called a herniated disc. It is a condition where one of the discs between two vertebrae, the soft tissue cushions that separate the vertebrae, bulges out or slips out of position. This can cause pain, numbness, or tingling in the affected area. If the bulging disc presses on a nerve, it can cause pain and other symptoms in other parts of the body. Which parts of the body is affected and cause pain due to slipped disc? Pain usually occurs in the affected area, such as the back, neck, or legs. Numbness, tingling, or weakness may also occur in the arms or legs. In some cases, the pain can shoot down a leg or arm. Symptoms of slipped disc. The symptoms of a prolapsed disc depend on the location and severity of the disc bulge. 1. Herniated or slipped disc in the back, herniated lumbar disc. It's common for a herniated disc in the lower back to cause sciatic nerve pain. This sharp pain usually shoots down one side of your buttocks into your leg and sometimes the foot. Other symptoms of a herniated disc in your lower back include back pain, tingling or numbness in the legs and or feet, muscle weakness. 2. Herniated or disc in the neck, herniated cervical disc. Symptoms of a herniated disc in your neck include pain near or between your shoulder blades, pain that travels to your shoulder, arm and sometimes your hand and fingers, neck pain, especially in the back and on the sides of your neck, pain that increases when bending or turning your neck, numbness or tingling in your arms. What are the causes of slipped disc? The most common causes of slipped discs include age-related wear and tear, weak core muscles, obesity, poor posture, and traumatic injury. Other contributing factors include repetitive motions, certain medical conditions, and genetics. At what age group and sex, slipped disc conditions occur in general? Slipped discs can occur at any age, but are most commonly seen in people between the ages of 30 and 50. Women are more likely than men to suffer from a slipped disc due to their increased risk of osteoporosis and other conditions that can weaken the spine. Risk factors for herniated disc. Factors that can increase the risk of a herniated disc include 1. Weight. Excess body weight causes extra stress on the discs in the lower back. 2. Occupation. People with physically demanding jobs have a greater risk of back problems. Repetitive lifting, pulling, pushing, bending sideways and twisting also can increase the risk of a herniated disc. 3. Genetics. Some people inherit a predisposition to developing a herniated disc. 4. Smoking. It's thought that smoking lessens the oxygen supply to discs, causing them to break down more quickly. 5. Frequent driving. Being seated for long periods combined with the vibration from the motor vehicle engine can put pressure on the spine. 6. Being sedentary. Regular exercise can help prevent a herniated disc. How serious is slipped disc to treat? The severity of a slipped disc can vary, and treatment depends on the individual case. Most cases can be treated with conservative measures such as physical therapy, medications, or lifestyle modifications. In some cases, surgery may be necessary if the pain does not improve with other treatments. What can I do at home to relieve herniated disc pain? In most cases, pain from a herniated disc can go away in time. To ease pain while your disc heals, you can rest for 1 to 3 days, if the pain is severe, but it's important to avoid long periods of bed rest to prevent stiffness. Take an over-the-counter pain reliever, such as ibuprofen or acetaminophen. Apply heat or ice to the affected area. When should I see a doctor? Initially, you can treat herniated disc pain at home, but you should see your doctor if 1. Pain interferes with daily life, like going to work. 2. Symptoms aren't better after 4 to 6 weeks. 3. Symptoms get worse. 4. You develop loss of bladder or bowel control. 5. You notice tingling, numbness or loss of strength in your arms, hands, legs or feet. 6. You have trouble standing or walking. Complications of herniated disc. Just above your waist, your spinal cord ends. What continues through the spinal canal is a group of long nerve roots that resemble a horse's tail, cauda equina. Rarely, disc herniation can compress the entire spinal canal, including all the nerves of the cauda equina. In rare instances, emergency surgery might be required to avoid permanent weakness or paralysis. Seek emergency medical attention if you have 1. Worsening symptoms, pain, numbness or weakness can increase to the point that they hamper your daily activities. 2. Bladder or bowel dysfunction. Cauda equina syndrome can cause incontinence or difficulty urinating even with a full bladder. 3. Saddle anesthesia. This progressive loss of sensation affects the areas that would touch a saddle: the inner thighs, back of the legs and the area around the rectum. How is slip disc diagnosed? The doctor will examine the affected area to determine the location of the bulging disc and assess for any nerve damage. Physical examination. Slip disc is typically diagnosed through a physical examination. Imaging tests such as an X-ray, MRI, or CT scan, and possibly nerve tests. The doctor will examine the affected area to determine the location of the bulging disc and assess for any nerve damage. During the physical exam, your doctor will check your back for tenderness. You might be asked to lie flat and move your legs into various positions to help determine the cause of your pain. Your doctor may also perform a neurological exam to check your reflexes, muscle strength, walking ability, ability to feel light touches, pinpricks or vibration. In most cases of herniated disc, a physical exam and a medical history are all that's needed for a diagnosis. If your doctor suspects another condition or needs to see which nerves are affected, he or she may order one or more of the following tests. Imaging tests. 1. X-rays. Plain X-rays don't detect herniated discs, but they can rule out other causes of back pain, such as an infection, tumor, spinal alignment issues or a broken bone. 2. CT scan. A CT scanner takes a series of X-rays from different directions and then combines them to create cross-sectional images of the spinal column and the structures around it. 3. MRI. Radio waves and a strong magnetic field are used to create images of the body's internal structures. This test can be used to confirm the location of the herniated disc and to see which nerves are affected. 4. Myelogram. A dye is injected into the spinal fluid before a CT scan is taken. This test can show pressure on the spinal cord or nerves due to multiple herniated discs or other conditions. 5. Nerve tests. Electromyograms and nerve conduction studies measure how well electrical impulses are moving along nerve tissue. This can help pinpoint the location of nerve damage. 6. Nerve conduction study. This test measures electrical nerve impulses and functioning in the muscles and nerves through electrodes placed on the skin. The study measures the electrical impulses in nerve signals when a small current passes through the nerve. 7. Electromyography, EMG. During an EMG, a doctor inserts a needle electrode through the skin into various muscles. The test evaluates the electrical activity of muscles when contracted and when at rest. What is the best slip disc treatment? You may need more advanced treatments if your symptoms aren't getting better. Your healthcare provider might recommend 1. Medication. Your provider may prescribe an anti-inflammatory pain reliever or muscle relaxant. 2. Physical therapy. A physical therapist teaches you an exercise program to help relieve pressure on your nerves. Exercise loosens tight muscles and improves circulation. 3. Spinal injections, called an epidural or nerve block. A spinal injection is a shot of steroid medication directly into your spine. The medication reduces swelling and inflammation of the nerve from the disc herniation. This will allow your body to heal and return to activity faster. 4. Surgery. In rare cases, a large herniated disc might injure nerves to the bladder or bowel. That may require emergency surgery. For non-emergency cases, surgery is an option when other treatments fail. There are various ways to perform spinal decompression surgery, but the goal is to relieve pressure on the nerve. At which point, doctor usually recommends surgery to treat slipped disc. Surgery is typically only recommended when other treatment options have failed to provide relief. In some cases, surgery may be recommended if the disc is pressing on a nerve, causing pain and muscle weakness, or if the disc is causing instability in the spine. Herniated discs get better on their own over time or with non-surgical treatment for 9 out of 10 people. If other treatments don't relieve your symptoms, your healthcare provider may recommend surgery. There are multiple surgical techniques for relieving pressure on the spinal cord and nerves, including 1. Discectomy to remove your herniated disc. 2. Laminectomy to remove part of the bone around a herniated disc and expand your spinal canal. 3. Artificial disc surgery to replace a damaged herniated disc with an artificial one. 4. Spinal fusion to directly join 2 or more vertebrae together to make your spine more stable. What is the success rate of surgery in treating slipped disc? The success rate of surgery for a slipped disc varies depending on the severity of the condition. Generally, most patients experience significant improvement in their symptoms after surgery. The success rate of surgery for a herniated disc is estimated to be between 70 and 90%. What is the procedure of performing surgery for slipped disc? The procedure for a slipped disc surgery depends on the severity of the condition and the type of surgery chosen. Generally, the procedure involves making an incision in the affected area and removing or repairing the affected disc. In some cases, a portion of the disc may be removed and replaced with an artificial disc or a bone graft. What is the recovery period after slipped disc surgery? The recovery period after slipped disc surgery varies from patient to patient and depends on the type of surgery performed. Generally, patients can expect to take several weeks to several months for full recovery. During the recovery period, physical therapy and rehabilitation may be recommended to help strengthen the affected area and restore mobility. Alternative medicine. Some alternative and complementary medicine treatments might help ease chronic back pain. Examples include chiropractic. Spinal manipulation has been found to be moderately effective for low back pain that has lasted for at least a month. Rarely, chiropractic treatment of the neck can cause certain types of strokes. Acupuncture. Although results are usually modest, acupuncture appears to ease chronic back and neck pain. Massage. This hands-on therapy can provide short-term relief to people dealing with chronic low back pain. How can I avoid getting a herniated disc? It's not always possible to prevent a herniated disc, but you can reduce your risk by 1. Using proper lifting techniques. Don't bend at the waist. Bend your knees while keeping your back straight. Use your strong leg muscles to help support the load. 2. Maintaining a healthy weight. Excess weight puts pressure on the lower back. 3. Practicing good posture. Learn how to improve your posture when you walk, sit, stand and sleep. Good posture reduces strain on your spine. 4. Stretching. It's especially important to take stretching breaks if you often sit for long periods. 5. Avoiding wearing high-heeled shoes. This type of shoe throws your spine out of alignment. 6. Exercising regularly. Focus on workouts that strengthen your back and abdomen muscles to support your spine. 7. Stopping smoking. Smoking can weaken discs, making them vulnerable to rupture. Consider quitting smoking. Are there other ailments which could cause some common symptoms? Sciatica. Sciatica is a term for pain that radiates along the sciatic nerve, typically from the lower back and down the back of the leg. Symptoms may include sharp pain, numbness, or tingling. Varicose veins. Varicose veins are enlarged, swollen, and twisted veins. They are typically found on the legs and can cause pain, itching, and cramping. Osteomyelitis. Osteomyelitis is a type of bone infection caused by bacteria, fungi, or other microorganisms. Symptoms include fever, chills, and pain in the affected area. Deep vein thrombosis. Deep vein thrombosis, DVT, is a condition where a blood clot forms in a deep vein of the body, usually in the legs. Symptoms include pain and swelling in the affected area. Buerger's disease. Buerger's disease is an autoimmune disorder that affects the lungs. Symptoms include shortness of breath, chest pain, and coughing.